If it's not patient-centered care, what centered care is it?
I'm not sure. I'm not sure. I really don't know how to call our healthcare because I don't really see health. I don't really see care for many chronic patients that we see, especially if the patients have different ethnic backgrounds, minorities, language barriers, social determinants, and health other disparities that we see. Really, where is health and where is care?
Wow, that's such a powerful yet stinging statement. I don't see health and I don't see care. And so you went into pharmacy thinking this is my way to bring health and bring care to healthcare.
Mm-hmm.
What did you experience when you became a pharmacist? Were you able to do that?
It can be a mixed answer, but short answer is no. And in current setting where we are at, there's a lot of limitations. As a pharmacist, my answer, and that was the reason why I worked as a patient advocate for a little bit to change how I could take care of patients. I didn't really find ways I could practice as I wanted. So that's why I'm being passionate. I feel like I'm everywhere advocating for patients, but my focus is the well-being of patients, nothing else, nothing more. And when you have that crystal clear focus on patients, you get burnout, you get moral injury because, your purpose of being who you are as a healthcare professional is being compromised. And I know your podcast is all about that. So I really love what you advocate for.
So along those lines, have you experienced burnout?
Yeah, of course. As a personal burnout, many pharmacists in retail settings and community pharmacies, it has been only a couple of years or a few years that we started getting assigned breaks. We used to be spending 8 to 12 hours all day without proper bathroom lunch break.
Wow.
And when I share this, a lot of people say, isn't that illegal? If the law and the setting does not allow you to have a break, what else can you do? There were multiple attempts from pharmacists organizing, requesting rights to get proper breaks over the years, but it has been turned down. It really took a long time for big chains to really have assigned time for break. And who wouldn't get burnout? Who wouldn't?
Yeah.
Right? I work in a hospital, and in a hospital setting, there's so much you can get burnout from. One example can be with COVID, and this is happening everywhere, short staffing affects pharmacy too, not just nursing. It's not just nurses. In hospital setting, we have short staffing too. That's something that anyone, I think, it's not about who you are. Anyone will get burnout from it. And in that setting, how can you take care of patients properly?
Exactly. Because when you start having these symptoms of burnout, medical errors go up.
Mm-hmm. And I mentioned also that it becomes a moral injury that you question why you're there. Why am I here? You question your purpose. So it affects your entire being, not just the care the patients are receiving. Your entire being is compromised.
For us, by us, and just for us, this is hope for med.